Hey there, good morning. We are going to talk about polycystic ovary syndrome. This is going to be, this is very timely and it's an important topic. So please join me. Hey there, Love Leah, Sammy1221, Journey to Baby, Nosh Fem Chick, hey. We're getting ready to talk about polycystic ovary syndrome. Looking forward to Dr. Laura Eisman from the Reproductive Sciences Center of the San Francisco Bay Area, who's going to be our featured expert. So do you guys have questions about PCOS? Because this is really intended to be interactive, and I want to make sure that we get your questions asked. Okay, RSC Bay Area. Great. Accept. And she should be on in just a second. Accept. Post your questions, you guys. We're going to have some fun today. It's going to be quick, but it's going to. There we go. It's Mayank. Hi, all the way from India. All right, Dr. Eisman, I have tried to accept you 3 times. Please come on and join me. We're going to have a frank conversation about polycystic ovary syndrome. Who, what, when, why, and where. Who gets it? What causes it? Hello, good morning, Ron, KKY11. Good to see you. So who gets polycystic ovary syndrome, also known as PCOS, which is not just one condition. It's like a constellation of conditions. Why does it happen? RSC Bay Area is unable to join. Let me try that again. RSC Bay Area, if you guys could do me the favor of logging out and trying to log back in again, hopefully we'll be able to get you. There we go. We're here.
Good morning.
Good morning, Kimberly Gibson. Okay, so I'm really happy. We have Dr. Eisman from the Reproductive Sciences Center of the San Francisco Bay Area. How are you doing today?
Good. Thank you for having me. Good morning, everyone.
Yay! And it's super early, so I appreciate you being willing to come on and join me at 8 in the morning in California.
Me too. Thanks.
Awesome. So let's get right into it. She is a reproductive specialist. You want to talk a little bit about yourself and why you decided to pursue this career?
Sure. Well, I love working with women, and I love working with them in these, difficult needs and difficult scenarios. And polycystic ovary syndrome is something we see all the time, and so it really affects women in all aspects of their life, including when they're trying to conceive. And yes, I am at Reproductive Science Center. We do a lot of infertility, and this is one of the main causes of infertility.
So infertility affects 1 in 8. Can you talk about a little bit about how many of those have polycystic? Well, let's back up. What is polycystic ovary syndrome? And then, we'll get into the how many people have it, why do people have it, and what can we do to treat it?
Sure. So polycystic ovary syndrome is the most common endocrine disorder in reproductive age women. So it's a hormonal disorder, and it is a syndrome. So it is a group of signs and symptoms. It's not a specific disease that has a specific cause, but it's just a group of symptoms. And those include irregular menstrual cycles, which is a reflection of not ovulating regularly, elevated androgens, mainly testosterone and related hormones, and that can manifest as excess hair growth or acne, or we can see elevated levels in the blood. And the third sign is polycystic appearing ovaries on ultrasound. So ovaries that have many follicles or large volume.
So Regina from Broken Brown Egg says PCOS is a jerk. Thanks for talking about that. It's a big jerk. Okay, so let's take a step back, because you talk about elevated androgens and excess hair growth, but we're not talking about like this hair. We're talking about male pattern hair growth.
Male pattern hair growth, right? So upper lip, chin, chest, upper arms, the back. Yeah, and there's, many different areas we can assess. But a lot of women will say, I have to wax my upper lip and my chin. Yeah.
And, most women have hair outside of what's considered kind of a hair on our face. But this would be if you feel like you need to wax, right?
Right. It's really if you feel it's excess, right? Whatever feels to you like excess hair growth, right? So yes, if you feel like you need to do some sort of hair removal. Yeah.
Oh, okay, great. And so why does it happen?
Well, we don't know exactly. There's not one specific cause. It's probably multifactorial, some genetic components, some environmental components. And, it's really just a altered hormonal milieu. It's our altered hormonal environment where there's elevated androgens, androgens in the ovary, and that leads to this anovulatory state, the state where we're not ovulating. It's kind of a steady state as opposed to a cyclic menstrual cycles.
Okay, so let's kind of dig into that. When you talk about cyclic menstrual cycles and anovulatory state, that means people are not ovulating and having regular periods, right?
Correct. You can ovulate. Women with polycystic ovary syndrome can ovulate more sporadically, usually if they do, but some do not at all. Yeah.
So if I skip a month, is this something that I should be concerned about? Or are we talking 6 months, 8 months? What is that?
So I would say if your menstrual cycles are routinely longer than 34 days, or you're skipping multiple cycles, women in general can skip a cycle here and there. But if you're regularly skipping cycles, that's when we want to hear about it. Yeah.
So if you're having long periods, and 34 days sounds like a long time to be bleeding, right?
So not bleeding, but between bleeds. So
okay.
One bleed to the next bleed, if that's longer than 34 or 35 days, right. But not the length of the actual bleed.
And is the length of the actual bleed longer or shorter?
It doesn't, in anovulatory cycles, it may be light or kind of different than you would expect from a normal period. But it doesn't matter quite as much as the length of the total length of the cycle.
And PCOS doesn't just deal with our female parts. Doesn't it cause other outcomes that may be considered, not just reproductive? It's not just about having babies. It's bigger than babies, as Regina from Broken Brown Egg would say. And she says, story of my life. And for me, that was the length of the actual bleed.
Oh, yeah. Anovulatory bleeds can, if it's been a while without a bleed, and anovulatory bleeds, yes, can be kind of irregular or outside of what we would expect to be a normal menses. But as far as other impacts on other aspects of our health, absolutely. It's associated with overweight and obesity, insulin resistance and diabetes, high blood pressure, elevated cholesterol, and all, cardiovascular disease in general. So also, when we don't have regular menses, it can lead to overgrowth of the lining of the uterus, precancer, and cancer of the lining of the uterus, of the endometrium. So we want, with polycystic ovary syndrome, are either on or on oral contraceptives where they're not bleeding, which is fine, or having a regular bleed.
And so let's talk about the oral contraceptives, because, often the reason why PCOS is such a big deal in the infertility community is because you need to ovulate to get pregnant. And if someone hey, Kelly, we've got Kelly Stewart in the house, the advocate. But if you are taking birth control pills to help out with your PCOS, and you are experiencing infertility as a result of your PCOS, how do you, beyond that, to get pregnant?
Yes, if you're trying to conceive, we don't want you to be on oral contraceptives, right? That's really for women with polycystic ovary syndrome who are not trying to conceive. We want them to have some sort of progestin or progesterone to prevent the overgrowth of the lining of the uterus. But when women with polycystic ovary syndrome are trying to conceive, we can help them to ovulate with medications like letrozole or Clomid.
Okay, so let's kind of dig deeper into the treatments, because we just talked about some women will ovulate if they get the letrozole or the Clomid. Are there other treatments available for women who are both trying to conceive, as well as those who may know that they have PCOS but not be ready to become a parent?
Well, kind of first thing is we know that some in women with polycystic ovary syndrome who are overweight or obese, we know that a small amount of weight loss can actually bring back regular menses. So that is a place to start. Or for women who are thinking of, not quite ready yet, but that's kind of a good thing to start with. As far as, ovulation, we usually will start with letrozole for women with polycystic ovary syndrome, but we use Clomid sometimes too. And we have multiple doses, so if women don't respond to the lowest dose, we can increase and see if they'll respond to higher doses.
So weight loss and the letrozole and the Clomid. But what about for the ladies who, are not kind of in this fertility world because it's an endocrine issue? What else can they do outside of just losing weight? And actually, we have a question. I often get teens, how should the teens deal with it? Yes.
For teens, it's a little bit tricky to make the diagnosis, and we want to make sure that they're at least 2 years from menarche, from their first menstrual period, because anything goes in those first 2 years. Those cycles can be really irregular.
Okay.
But if they've had irregular cycles for more than 2 years since menarche, then the way we want to make the diagnosis is mainly with elevated testosterone in the blood, and not just the signs on exam, because a lot of adolescents have acne, right? Hirsutism, if it's really, significant, that can help make the diagnosis. But also,
what is that?
The excess hair growth.
Okay.
And when we look at the ultrasounds of teens, multiple follicles on the ovaries is also reflecting good ovarian reserve, a lot of eggs, which we often see in young women, right? Who we have more eggs when we're young, right? And the number of eggs declines as we age. So that's something we often see. So we want to try to use a large volume ovary that might be a little more specific and to help us make the diagnosis as opposed to the number of follicles.
So we've talked about what it may look like on the outside, and now we've also talked about what the ovaries may look like on the inside, as well as some other health challenges, because we only have a few minutes left. What can people do? Where can people find support if they're dealing with PCOS?
Well, absolutely come see a reproductive endocrinologist. We see this all the time. We can make you feel a lot better that you're not alone. But the other places you can go for more information, American Society for Reproductive Medicine, ASRM website has more information. There is a PCOS Society, PCOS Challenge, and also the Resolve, the National Infertility Association. You can go to all of those sites and find more information and support.
And so for anyone who's watching us, if you have if you have an organization or a doctor that is on social media, or just another resource, please drop it in the chat, and we'll make sure that we post it in the comments when this is reshared. A lot of good stuff going on in the PCOS community. I know that PCOS Challenge has had several advocacy days. I know that we didn't talk about this, but are you aware of any upcoming opportunities to advocate if you have PCOS, and let the people who make laws on your behalf know that this is something that you care about?
I actually am not aware, but I would definitely check out that PCOS Challenge site and the Resolve site.
So I'm going to plug tomorrow's Coffee with Cade, featuring Regina Townsend with the Broken Brown Egg and Nichelle Poston from Resolve. And they're going to be talking about that issue. They're going to be talking about the upcoming Resolve Advocacy Day, which you can still register for and participate in virtually. so that you can let your legislators know that PCOS and other family building issues are important to you. Closing thoughts, Doctor.
Mainly just that you're not alone. This is really common, and there are so many things we can do to help and get you through it and answer your questions. If you want to come and see reproductive endocrinologists, we're here for you. We support you.
And if people want to follow up and they want to schedule an appointment with you, can you please provide the contact information?
Reproductive Science Center. You can go to our website, RSC Bay Area, and I'm Laura Eisman. I'm happy to see you.
And you see people at which offices?
I see people at Oakland and San Ramon, but we have offices also in Los Gatos and Foster City.
Okay, so the San Francisco Bay Area, if you're out there, Dr. Eisman will take good care of you. Before we finish, we always ask this question with Coffee with Cade. What's in your cup? Did you get that Cade mug that I sent?
I didn't get a mug, but I already drank my coffee this morning. But I will look out for that mug.
Yeah, ask Joanne about it because I sent it a few weeks ago. So I'm sorry you didn't get it, but hopefully it will be useful. It's a reusable coffee mug. Yes, Kelly, buy some teal. And I had a cup of Earl Grey in my mug. So thank you, everyone. Thank you, Dr. Eisman. I appreciate your support. And thank you, Regina. Thank you very much, Teal. And I will see you tomorrow. Please come back. Join us tomorrow, noon Eastern Standard Time, where Regina from the Broken Brown Egg and Nichelle from Resolve will be talking about opportunities to advocate and to share your voice and let the people who make the laws know about things that are important to you. Thank you so much. I'll talk to you soon. Be well. And I'll see you, Dr. Eisman, in September.
Yes. Awesome.
All right. Bye. Be well.